So we're going to do skill 25, catheter care. This is an indwelling catheter, and so Miss Claire has one on right here. I'm going to cover her back up, but I just want you to know the properties or how these work is it drains urine from your bladder. To stay in your bladder, you insert it and you have to inflate this balloon, and that creates an anchor, and that's what keeps it in the bladder. So when you have a catheter, or somebody with a catheter, you have to be very, very careful if you're transferring them, especially if you're transferring them, that you, or even turning them, that you're not pulling on this tube, because there's times they will come out, times they'll pop and come out, and sometimes not. If the balloon doesn't pop, it's a very painful process for the patient. So with that being said, I'm going to go ahead and start my skill. I'm going to knock. I'm going to say, hey, Miss Claire, it's Peggy, your CNA. I'm going to do catheter care. She says, okay. I'm going to check her name band. I'm going to do my hand hygiene, and I'm going to gather my supplies, which I've already gathered. I have my basin of water that I tested the temperature with. I'll have Miss Claire test my temperature. She says that's great. I have a washcloth. Actually, 2 washcloths. Let me get one more washcloth. A towel, my soap. Don't need lotion. I also am going to empty her catheter, so I have a graduate, and then I do have some alcohol wipes and a paper towel. So I'm going to go ahead. I'm going to provide my privacy. And I'm going to raise the bed for my comfort level. Put on my gloves. And then I'm going to create a window. So your top sheet is just going to simply fold down to about the knees, and then you're going to lift the gown, and that creates a window for me to work in without exposing everything. I'm going to go ahead and put my towel between her legs and under her hips. So don't get her bed all wet. And I will use it for drying. Once we're at this point, I'm going to unclip. She's got a holder for her catheter, and that helps keep from tugging if you happen to tug it. So I'm going to unclip the top of it by pushing the button, removing it, and at this I'm also going to kind of look around the connection points of the catheter to make sure there's no redness or any swelling or drainage. Okay? So now I'm going to take my washcloth. Some soap on it, and just like perineal care is, you're going to use a different part of the washcloth with each swipe. So I'm going to hold as close as I can to the meatus here, but I'm also going to pinch it a little bit so I'm not pulling it out. And I'm going to go ahead, I think in the skill it says at least 4 inches. I go ahead and do the whole thing. That's one swipe. I'm going to do another swipe. And 3. So I'm going to get rid of my washcloth in the hamper, and now I'm going to rinse. If there's a lot of drainage around the catheter, it might take more than 3 swipes, and you want to make sure it's clean. So don't use 3 as your indicator. You want to make sure it's completely free of any sort of drainage or discharge. So 1, and sometimes feces. I mean, you just never know. 2. And 3. So now I'm going to go ahead and dry it. And then then I'm gonna go ahead and hook it back into my holder. Only if it'll go in though. I'm gonna go ahead and remove my towel, because I'm done at this point. I'm gonna remove a glove. Maybe. And I'm just gonna go ahead and cover her a little bit so that she's not sitting there exposed. And then I'm gonna lower her bed for safety. I'm gonna get rid of my towel. I'm gonna take off my gloves. I'm gonna do my hand hygiene and come back. And put on new gloves. Stephanie, you might wanna come over here because I'm gonna empty her catheter now. So the urine drains into a bag. So I am going to place, I'm going to open one of my, I think they call it an antiseptic wipe, which is basically an alcohol wipe. And I'm going to go ahead and place this on the floor and put my graduate on the floor, on the paper towel. I'm going to remove my bag. You can raise the bed and do it from under the bed. I think it's easier to see, personally, for me to pull it out. So you're going to unclip the spout from the holder. Ooh, it's a leaky one. And then you're going to, there's a clamp. You're going to go ahead and open the clamp. And drain all of the urine out into the graduate. Once it's done draining, you will squeeze the clamp locked again. And before putting it back into the spout holder, you're going to clean it off with your antiseptic wipe. Goes back into the hang it back under the bed. When you're hanging your bags, they only go on non-movable pieces of the bed. They don't go on the side rails. And then I'm going to go ahead, I'm going to put this on my table. I'm going to measure it. And then I'll come over here. And I'm going to go ahead, and she's still low, so she's still safe. I'm going to empty it into the toilet. It's our makeshift toilet. And I'm going to rinse. And my rinse water I'm going to empty into the toilet also. This is just empty rinse. It is not dry. I'm going to remove my gloves, do hand hygiene, and come back. Put on my new gloves. And now I'm going to make sure Miss Claire is set. So I'm going to go ahead and readjust her gown and her top cover so she's comfortable. Miss Claire, are you comfortable? She said yes. Here's your call bell if you need anything. I'm going to open my curtain. And then I'm going to take my water basin. I'm going to empty, rinse, and dry that guy. I'm going to remove my gloves. I'm going to do hand hygiene. I'm going to take my linen out, do hand hygiene again, and record and report skill